When thinking about herpes testing, it's important to make a distinction in two types of testing, really. One is testing a person who presents in a clinic or with a doctor that actually has lesions, genital lesions, and so we can test those lesions with very specific testing to see if that lesion is caused by herpes. Herpes culture is sort of the old standby. Many clinics, including ours, are still doing culture. The problem with culture is that it's not, it's very specific, meaning that if it's positive, we actually know that herpes is present, but it's not necessarily very sensitive, especially in somewhat older lesions. A person comes in typically not immediately after he or she breaks out with herpes. Usually there's a couple of days that go by. During that day, shedding of the virus it decreases, and so the sensitivity of these cultures is decreasing. So we really need to have much more sensitive tests, and we now have DNA testing as we do for a lot of other things. And so we can do DNA testing, and some laboratories are actually doing that, and it appears that more and more clinics and doctors are offering this much more sensitive test. That test can also make a distinction between the different types of herpes. Herpes simplex virus type 1, which typically occurs around the mouth. Cold sores is basically what we call that. And the genital lesions are typically type 2, even though the proportion of lesions that are caused by type 1 in the genital area is increasing. So it's important to know what's causing these lesions, and having a much more sensitive test would be of great use for us in the clinics. Then secondly, there are so-called serological tests that are testing to antibodies, meaning our immune system develops a resistance against these viruses, making antibodies, and you can detect those antibodies in the blood. And so we have very good sensitive as well as specific tests to detect antibodies against type 1 or type 2.
To summarize, the two types of tests, the one is the direct test for the virus, can tell you immediately whether herpes is causing that particular lesion or not. And then there's the antibody test, the body's immune reaction, and it takes several weeks, sometimes up to 3 months, to develop those antibodies. So there's a delay between onset of infection and when the test can become positive. Right. And then beyond that, the antibody tests are not perfect. If someone has lesions, clearly the preferred test is a direct test for the virus. Ideally, a DNA test if it's available, because it'll pick up more infections than culture. So we absolutely agree on that. I want to take a slight tangent and reemphasize what you alluded to and the importance of knowing virus type. There are some physicians out there who say, oh, it's just herpes. You don't need to know virus type because herpes is herpes no matter what. And in fact, there is a big difference. If you're unlucky enough to get genital herpes, but lucky enough that it's HSV1, typically acquired by oral sex, because HSV1 more commonly causes oral herpes. That's actually a good news scenario, because the clinical course and need for treatment are very different from the two diseases. Genital HSV1 recurs much less frequently. In fact, probably 40% of people never have a second outbreak, and the others typically have an outbreak once every year or two, as opposed to an average of 3, 4, 5, up to 10 times a year with genital HSV2. The need for treatment, therefore, is different. The potential risk for transmission to partners is different, and it is critical for everybody with genital herpes to know, and for their physicians to know, that they have to know virus type. And you can determine that either by culture or DNA testing, which can determine the virus type, or by the antibody tests, which are also the proper kinds of tests. There are some older tests out there that don't accurately distinguish type 1 from type 2 in terms of blood test. So those people who are getting tested, and physicians and clinics who are ordering those tests, need to be sure they are requesting a type-specific test. The other thing I want to say about antibody testing, by the way, is that many labs automatically offer what's called IgM testing, immunoglobulin type M, as opposed to immunoglobulin type G, or IgG testing, in theory, becomes positive sooner than IgG. And so an IgM test for some infections can help detect early as opposed to late infection. The problem is that it often doesn't work that well with herpes. The IgM testing often doesn't precede IgM antibody, but the test also has a lot of false positive results. The labs offer these tests because, quite frankly, they are very cheap to do, they have a high profit margin, and there is just an assumption that it's a good thing to do. And docs, not knowing the difference, just order what the lab shows on its panel and they check off the box. My advice and this is going to be in the upcoming revision of the CDC's STD management guidelines that are going to be released in early 2015, that IgM testing for HSV has no role whatsoever. Doctors ordering tests, please do not request the IgM test. Patients who are perhaps going to an online site and arranging your own HSV testing, ignore the IgM, don't do it. It'll get you in more trouble than it will help.